Hello, my name is Maggie Roman, and I'm doing a head-to-toe exam on my volunteer, Nina, and we are doing an assessment for health assessment, Nurse 612. We're with Maryville University. Prior to the exam, I had Nina empty her bladder and change into a patient gown. We got a full set of vital signs. I took her height, her weight, and we calculated her BMI. Outside of the exam room, we measured distance vision with the Snellen chart. Her vision is 20 out of 20, and she does not wear corrective lenses. So throughout the exam, I'm going to be assessing her skin and her cranial nerves. There's no particular order. So I'm going to look at her face, and her features are symmetrical. Her ears and her eyes line up. Her nose is in the middle of her face. I'm going to look at her hair. It's thick and looks pretty healthy. I'm going to palpate her skull for any lumps or lesions in her facial bones. Do you have any pain or tenderness?
No.
Okay. Alrighty, so I'm going to have you wrinkle your forehead, smile, puff out your cheeks, stick your tongue out, and squint. Okay, so her cranial nerves are intact. I'm going to test your sensation. I'm just going to lightly brush a cotton ball against her skin, and you tell me if you can feel it.
Mm-hmm. Yep. Yep.
Okay. I'm going to assess your eyes. So just looking at her eyes, she doesn't have any redness. Her sclera is white. I'm going to palpate her lactivia for any lumps or lesions. Those are within normal limits. Her eyebrows are evenly distributed. Her eyelashes are evenly distributed. I'm going to look at her eyes to test her light reflex. And I'm testing her direct and consensual reflexes here. I'm going to also assess her disc and lens. The red reflex. Okay, so I'm going to have you follow my finger without moving your head. Okay, I'm also going to have you put your finger on your nose and tap my finger. Okay, so all those nerves are intact. I'm going to also palpate her sinuses at this time for any tenderness or pain. Feel her TMJ joint open and close your mouth. Move side to side. Okay, she does have an abnormality here where her joint isn't connected to that joint. I'm going to palpate her lymph nodes, preauricle, posterior auricle, occipital, submental, submandibular. This is her deep cervical chain, posterior cervical chain, and subclavicular lymph nodes, and she has no pain or tenderness there. Okay. So looking at Nina's ears, they're pretty symmetrical. I'm palpating her external ears. She has earrings all over the place here. I'm going to test her hearing. Come behind her. I'll have you cover one ear. I'm going to whisper a word.
Baseball. Baseball.
Okay, cover the other ear. Apple.
Apple.
Okay. I'm going to look in her tympanic membrane and her external, or her ear canal. So with adults, you want to pull up and back. She's got no earwax. Tympanic membrane was a bluish gray color. She does have some wax on this side. And I can see some scarring of a previous ear infection. She's never had tubes. So we're going to do the Rain and Weber test to test her bone and ear conduction. So I'm going to smack my hammer and put it towards your ear, and you're going to tell me if you can hear it or not.
Mm-hmm.
Okay, tell me when you cannot hear it.
Okay.
Can you hear it?
Mm-hmm. Okay.
Bone conduction is a lot longer than ear conduction. Tell me when you can't hear it.
Okay. Okay.
So her hearing is intact within normal limits. Okay. So next I'm going to look at her nose. Have you ever broken your nose? Okay. Palpate her external structures. There's no lesions. So she is pink and moist up here. I don't see any abnormalities. Her septum is within normal limits. Okay. I'm gonna have you close your eyes for me. I'm gonna have you smell something.
Okay.
What is it?
Alcohol.
Okay. All right. So there's nothing wrong with her nose. Next, I'm gonna inspect her mouth. So her lips are pink and moist. I don't see any cold sores. Can you open your mouth for me? Her teeth look like she takes good care of them. Her gums are pink and moist. I'm gonna have you say ah. Okay. Her hard and soft palates are within normal limits, and they rise. She's had her tonsils removed when she was little, but I'm still gonna test her gag reflex. Okay. Say ah. Okay. Her uvula is midline and intact. No abnormalities in her mouth. Okay, so let's see. Moving on, I checked her lymph nodes. She's negative for JVD. I'm gonna have you shrug your shoulders. Okay. Move your head towards my hand. Testing strength here. Okay. Can you look up? Look down. Her neck, skin is smooth and within normal limits. Okay, I'm gonna feel for her carotid pulses at this time. And her thyroid, can you swallow for me? Okay. So far I can tell that her thyroid and trachea are midline. I'm gonna listen with the bell of my stethoscope to her carotid and her thyroid. No abnormalities there. So this is a really good time to inspect the skin and her chest. She is breathing